Hi folks, Mayor Davis. It's Thankful Thursday today, and that's where we want to show our appreciation thanks to all those who work in the front line. And today I have two very special guests who I'm meeting with virtually through Zoom. I'm trying to be a good role model. And I have with me today Lindsay Spry, who's a resident care coordinator at the John Noble Home. And I also have Amon Molly, who's a registered nurse. Now the John Noble Home is a municipal home for the aged. It's owned and run jointly with the city of Brantford and the county of Brant, and also the province of Ontario is a big partner. So I know that you'd like to tell us what's happening at the John Noble Home, and we want to hear what's happening at John Noble Home. So Lindsay, tell me what's happened since this COVID-19 crisis began at the John Noble Home?
So it's been a difficult time for everyone. We're doing our best here to make sure that our residents and our staff are protected from the virus. In order to achieve this, we've been following recommendations from the Ministry of Long-Term Care, Public Health, and Ontario Health, and we've implemented universal use of masks and personal protective equipment. We are screening all staff and residents twice daily for possible symptoms. We have strong visitor restrictions in place and careful infection prevention and control measures that we're following.
Thanks, Lindsay. So, Amon, you're up next. What are you doing to help the residents cope at this time? I'm sure it's a bit stressful for them.
Our home actually has a really amazing recreational staff that are working very hard to keep our residents and their loved ones connected by offering Skype visits. There is a weekly theme calendar of one-on-one programs available to our residents. And we also continue to receive letters, care packages from their loved ones, and then we are working towards safely delivering those packages to our residents.
Oh, that sounds great. And so how do you find they're doing, your observation of them? How are they doing generally?
I think they're coping very well at this point, and everyone is understanding that we are going through really hard times right now, and then they're very cooperative towards any restrictions, towards any recommendations that we're implementing.
Right. Lindsay, do you have anything to add to that?
I was just going to mention that on our Facebook page, we are posting all kinds of wonderful things that our staff are doing to keep the residents busy and engaged. We've even had some of our entertainers offer entertainment via Skype right into the residents' room, so it's been fabulous.
Oh, that's great. So, so how's everyone holding up, staff included? Amon, what's going on there?
I think, as we all know, that we are going through the stressful times for everyone. The home has been blessed with an outpouring of support from previous employees, residents, family members, our medical director, and various community members with lots of donations. For instance, flowers, pizza, snacks, and PPEs. We are also receiving a lot of uplifting messages from our, it's either on the Facebook, our residents, family members. For instance, there was a resident who stopped me in the hallway and said, "Thank you so much for coming to work." I think it's really rewarding. And also our community members, they're walking by our home and they're saying thank you and a lot of other good messages. They're just showing off that how much they support and they thank you to our dedication to our work.
Right. Lindsay?
Yeah, just to go along with what Amon was saying, we even had one of our nurses on her day off, brought her kids, and they did sidewalk chalk messages out front for all of the staff, which was really amazing to see. Our entire team is extremely dedicated and continue to provide exceptional care despite the increasing demands of COVID-19, not only here in the workplace, but also with, having to homeschool their children and all of the other things that are going on at home. So we're just really proud of how our staff have pulled together in this difficult time. They're absolutely a family to our residents, especially during this time.
Yeah, and so as mayor, I sit on the board of the John Noble Home. I got to tell you, I'm always impressed when I go in there, just how it has kind of a homey feel to it. Because many of these homes can get a little bit institutional in feel, but I've always been very impressed how the staff seem to go out of their way to make residents feel like it's their home. One question for you. I'm not sure who would want to answer this, but so I know the protocol, and so it has any residents who have, let's say, cold-like symptoms. They're given a special sort of treatment, and they're dealt with a bit differently. How does that work?
Absolutely. So any resident that develops cold-like symptoms is immediately put into isolation in their room, and staff begin to use protective personal equipment, such as gowns, gloves, and masks to protect themselves and other residents. And at that point, we would also be doing a swab for COVID-19 amongst other respiratory illnesses as well.
Right, and has anybody at the home, either staff or a resident, tested positive?
At this point, we're proud to say that we have not had any positive results in the home.
Right, and if someone ends up coming back, a test result comes back positive, how will the home deal with that?
The home has a pandemic plan, and in the event of a positive swab, we would begin to roll out our pandemic plan.
And that basically has them being isolated in a separate wing, is that not correct?
That's correct, yes.
Yeah. And what about PPE supplies? How's the home fitted in terms of its inventory of PPE for the staff?
So at this time, we have an adequate supply of PPE. Again, we're following all of the ministry guidelines and directives in terms of when and how to use the PPE, and we're fairly confident in the supply that we have coming in.
Right. Well, I want to say, Lindsay and Amon, thank you very much for taking the time to speak to me. And I got to tell you, I feel a little more comfortable now, having now met the two of you, knowing that you're on the scene helping to take care of these residents. And I really mean it from the bottom of my heart that I want to thank you. And on behalf of City Council and the city, thank you for your service in taking care of some of the most vulnerable residents in our city through a very difficult time. And I want you to have a great Easter weekend.
Thank you. You too.
Okay. Bye-bye.
Bye.